Good morning, good afternoon, good evening to you all, depending on your location. I'm pleased to welcome you to this webinar on behavior change intervention for healthy nutrition and lifestyle, which will be delivered by Dr. Samuel Folake. Dr. Samuel Folake is an Associate Professor of Community Nutrition in the University of Ibadan, Nigeria. She's well known for her several intervention programs, both within and outside Nigeria. At the end of the presentation, we will have a question and answer section. Please type in your questions or comments in the QA box so that we can have it and interact with it. Thank you. Dr. Samuel, please, you can now make your presentation. Thank you.
Thank you very much, FrieslandCampina Institute, for inviting me to join in this webinar and to make this presentation. Thank you very much, Dr. Charles, for the kind introduction. I'm excited to be here, and I'm excited to be joined by participants from all over the world. Thank you very much. Today we're talking about behavior change interventions for healthy nutrition and lifestyle. Let's see the outline of this presentation as follows. After a short introduction, we'll look at the behavioral origins of health issues. Then we delve into a few slides on the socio-cultural context of health and nutrition behavior, after which we can discuss food systems for healthy diets. Following all of these, we'll be talking about innovative behavior change innovation by nudging consumers towards healthy nutrition and lifestyle. And then we'll look at a few examples of successful behavior change interventions in Nigeria, and then conclude with some final thoughts. By way of introduction, we know that nutrition plays a big role in the global burden of disease. Worldwide in 2017, poor diet was linked to 11 million deaths. 9.5 million deaths was attributed to cardiovascular disease, almost 1 million from cancer, and about 1/3 from diabetes. And we know from the literature that poor diet causes more deaths than any other risk factor. Indeed, obesity, overweight, and diet-related non-communicable diseases are increasing worldwide in all population groups. We see that almost 2/3 of the world's obese people now live in low and middle-income countries. So it is not even a matter of rich countries alone, it is all over the different regions and population groups of the world. This is contributing to the large global burden of non-communicable diseases that we are currently facing. And because of this, there is a lot of global momentum to address nutrition challenges in the world. We see the UN Decade of Action on Nutrition, which is a commitment by United Nations member states to undertake 10 years of sustained and coherent implementation of policies and programs and increased investments to eliminate malnutrition in all its forms, both undernutrition and overnutrition. We also see the Sustainable Development Goals, which is very popular all over the world. The scaling up nutrition, also known as SUN, is also a movement that's led by countries committed to the understanding that good nutrition is the best investment in the future. A critical part of the scale-up nutrition movement is the SUN Business Network, which aims to engage and mobilize businesses at global and national levels to act and invest responsibly in improving nutrition. Part of the global momentum to address nutrition challenges is also the Eat Lancet Commission on Food, Planet and Health, which brought together more than 30 world-leading scientists from across the globe to reach a scientific consensus on what defines a healthy and sustainable diet, such that we can feed the whole world without necessarily destroying the planet. All of these are global efforts to address malnutrition. But what we see also is that there could be a missing piece, because in spite of the explosion of information about what constitutes healthy nutrition and healthy behavior and the risk factors related to diet, plus the global momentum to ensure healthy nutrition, we see that these global efforts do not automatically translate to healthier behaviors and better nutrition. So the question is, the missing piece, could it be behavior change interventions? We know that behavior is the product of individual or collective action, and it is a key determinant of the people's health. And that led to so many thoughts and the current understanding that the response to and the understanding of the epidemic of nutrition challenges must include or involve human behavior. Behavior takes place in social environments, and therefore efforts to change it to influence health must therefore take account of the social context, the political context, and the economic forces which are acting directly on people's health, regardless of any individual choices that they may want to make about their food, their feeding, and their diet. What determines our health? What are the determinants of health? We see that there are several interrelated factors as explained in this diagram: environmental factors, interlinking with socioeconomic factors and sociocultural factors, but also the individual factors that have to do with genetics, with the family, with attitude, and so many other things. And all that this picture is telling us is that what determines our health is a complex system, is a complex web. And so it is a rich context for intervention from different angles. Indeed, the socio-ecological approach, which is very famous, in it, health is viewed as a function of individuals and of the environments in which these individuals live, including the family, social networks, organizations, communities, and societies. Now, let's narrow down on behavior. Behavior could be health supportive, or it could be proved to be a barrier to health. In addition, the social and physical environment may or may not enable health supportive behavior, even if so desired by the individual. So the behavioral origins of health issues operate in a matrix of complex interactions in this so-called ecological context, which involves not only biological and individual factors, but also the surrounding environmental determinants. At this point, I would like to say that following from this, we see that trying to achieve healthy nutrition may not be a linear equation. In a linear equation, y equals to mx plus b, x and y are variables, b is a constant. It is arranged, it is linear, it is straightforward. However, we know that nutrition, healthy nutrition, is the product of many parts. And just as we have seen the many determinants of health, we see that nutrition also has many parts. And so we cannot look at just the parts. We have to look at the whole picture, or in other words, the full elephant. We cannot afford to influence nutrition and nutrition-related behavior with limited or partial knowledge, just like the lesson of the Indian fable of these 6 blind men and the elephant. We should rather look at the whole picture and not just the parts. Another thing that we need to lay a foundation about is that we know that scientific knowledge doubles every 5 years or so. Scientific disciplines such as biochemistry, physiology, biology, physics, and so on produce the knowledge that fits into nutrition science. And so sometimes it leaves the public kind of confused, thinking that nutritionists are always changing guidelines, and so on and so forth. But when we overlay that with the issue of behavior, whereby we know that food is both scientifically and culturally defined, we see that nutrition is not just a science, it's also an art, it's a social science. And that is why people sometimes wonder, is it still nutrition or nutrition? Because we have rapid and progressive revelations that we encounter in our research, teaching, and practice. And behavior, as human beings, we know that eating goes beyond feeding for survival. It is a pleasurable and fulfilling aspect of our lives. So as we continue to attempt to understand the nature and causes of many different health behaviors in nutrition, we have to draw on a large field of study that cuts across various fields such as psychology, education, sociology, anthropology, and so on. All of these ones help us to choose appropriate behavior change intervention approaches in order to bring about healthy nutrition and lifestyle. What we all see again is that misconceptions abound in the world. All that we are talking about is happening in a world that is very media-centric, with misconceptions and misunderstandings about health nutrition all over the place. So the need for effective behavior change interventions, correct and effective ones for healthy nutrition and lifestyle, becomes even more important in the light of this. To eat or not to eat? What is behavior change intervention all about? Behavior change interventions for healthy nutrition and lifestyle is not about telling people what they should do, what they should eat, or what they should not eat, but it is rather about motivating, inspiring, and enabling people to make behavior changes that will benefit their personal health as well as the overall well-being of their families. Behavior change intervention, as we know it, stands on the fact that giving people information, only information, does not make them change. It does not make them change. We rather have to motivate, inspire, and not just that, enable them to make these behavior changes that will benefit their lives. There have been some documented approaches to behavior change for positive health outcomes, and these have included trying to cajole or control health-related behavior of individuals, or protecting individuals from the behavior of others, or mobilizing the behavior of groups to influence health-related social and physical environments. And in this, also now gaining increasing utilization is the issue of nudging consumers towards healthy nutrition and lifestyle through innovative behavior change intervention. And now there's also the aspect of leveraging on food systems, leveraging of social-cultural factors of people, understanding and contextualizing health and nutrition behavior before we can design appropriate behavior change interventions. We know that people's ability to choose and sustain a healthy dietary lifestyle is greatly influenced by factors such as convenience, preferences, cultural norms and knowledge, and perceptions about nutrition and health. So while BCIs, or behavior change interventions, integrate theory and evidence, there is also need for proper contextualization within the socio-cultural and food systems of a population group. So when we design, implement, and evaluate behavior changing interventions, it's not just theory-based, but must be built on a foundation based of empirical and practical information, which is usually lacking. So we have some examples that we can look at. I have brought an example here from Bangladesh, where there's this study that looked at social-cultural influences shaping adolescents' dietary and physical activity, behaviors of rural adolescents in Bangladesh. And this qualitative study explored the different social-cultural influences that shaped behavior of the adolescents in terms of their diet and in terms of their physical activity. The findings demonstrated that the adolescents' food choices were remarkably taste-driven, inculcating a tremendous popularity of street foods and energy drinks among them. The study also found that there was a narrow perception of what constitutes a healthy diet. And many times in behavior change interventions, this is assumed that people understand what constitutes a healthy diet. The study also showed that there was a limited idea about the importance of balance and diversity in the adolescents' diet. And there was no enabling factor because there was suboptimal school and community food environment. There was peer influence that is working heavily to determine their feeding habits and their physical activity. Also found was the lack of affordability, which was acting in concert to limit their access to nutrient-rich foods and health-promoting diets. For the physical activity, the gendered pattern of sporting and physical activities pointed towards the rigidity of gender norms and community-wide approval for the gendered division of household labor with clear-cut power dimension. What was the conclusion of all of this? If all of these social-cultural influences are not taken into account, a BCI which is effective can never be planned and implemented effectively. So the social-cultural influences are very important all over the world. In Africa in particular, it is very important to understand the social-cultural events or social-cultural factors that is surrounding the different kind of nutrition behaviors without just importing ideas that have been tried and tested elsewhere, without contextualizing it properly within African context, within Asian context, European context, wherever, it might not work. Now let's look at the food systems approach to healthy diets. A food systems approach to healthy diets focuses on using entry points within the food system to influence the consumption of healthy diets by populations with the aim of attaining optimal nutritional status. Importantly, incorporated within this concept of the food system is the broader notion of a system, which implies that component parts work together and are in dynamic relationship with one another, such that when you make a change in one part of the food system, you can have an impact on another part of the system. And so the rationale for addressing healthy diets and good nutrition through food systems approach means that we are changing one part of the food system, and we can use that to shift the whole system towards better supporting healthy diets and improving nutrition, which ultimately means that it is easier for the population to access and maintain a healthy diet. However, sometimes when we change one aspect of the food system, it can result in unintended or unexpected consequences to other parts of the system, and these trade-offs may need to be considered when you are doing your behavior change interventions. So every aspect of the food system should be able to influence the availability, the quality, and accessibility of diverse, safe, and nutritious foods, and thus the ability of consumers to opt for healthy diets and develop healthy eating habits at each stage of their lives. So when we take a food systems approach to healthy diets, the question we're asking is, how do we make our food systems more enabling for BCI, for health and lifestyle changes? This is the conceptual framework of food systems for diets and nutrition. And right there, we see that consumer behavior is in the middle, being influenced by demographic drivers, sociocultural drivers, political and economic drivers. Even the political superstructure of the nation has a way to influence what the consumer chooses to eat, where he chooses to eat it, how it is prepared, cooked, stored, and eaten. So what we are saying is that consumer behavior is right there, sandwiched between issues relating to food supply chains, food environments, diets, and leading to nutrition and health outcomes that we want. Typically, nutrition policies do not incorporate the status and potential limitations of the food system. For example, when we want to change behavior in terms of recommending populations to eat daily at least 400 grams of fruits and vegetables, we need to consider if the food system will be able to provide that quantity of fruits and vegetables and at an affordable price to the entire population. So a food systems approach to healthy diets looks at these interlinkages and looks at the way healthy diets will result as the drivers, result from the key drivers, of food systems. Nudging consumers towards healthy nutrition and lifestyle through innovative behavior change interventions. A healthy diet, according to the World Health Organization, is one that contains fruits and vegetables, whole grains, fibers, nuts and seeds, with limited free sugars, sugary snacks and beverages, processed meats and salt. In a healthy diet, saturated and industrial trans fats are mostly replaced with unsaturated fats. However, most of today's food systems need to be realigned from just supplying food to supplying or providing high quality foods that support healthy diets. So what we are saying is, before we go into the issue of behavior, what does the food system support? You may give all the information that you want. You may even motivate and inspire. But if there is no enabling environment, there is no way that the behavior change interventions will work. So innovative behavior change interventions have to enable people to make the behavior change for healthy nutrition and lifestyle. It will not be complete if we don't look at theories. Behavior change interventions depend heavily on theories, and that is why we're saying, beyond motivating, inspiring, and enabling, it has to sit on a bedrock of theory, of evidence, and contextual understanding of the population and their behavior, their nutrition behavior. So we have some thoughts from the literature, the stages of change model, and then the intervention mapping theory. I would like us to look at that. And also we'll look at the issue of nudging, which is primarily drawn from behavioral economics and has attracted interest in recent years. It aims to nudge people's choices, not by removing the less healthy ones, but by making the healthy options easier, and by making it easier for an individual to actually adopt a good nutrition behavior. So let us quickly look at the stages of change model. And what this is telling us is that behavior change is very hard. And one of the primary influences for successful behavior change is how we handle setbacks and lapses. So in her paper, Megan Cole shared her experience as a psychologist, highlighting a natural pattern in behavior change intervention whereby a person experiences the discomfort of committing to something and then not following through. It has happened to every one of us. At the beginning of the year, you make a New Year resolution. This is how I'm going to eat healthy, exercise healthy. But by January 15, you already experience a kind of backsliding. The participants start enthusiastically and then get discouraged on the way as self-efficacy and willpower evaporates. What the application of the stages of change model is that we need to understand the setbacks and the times of backsliding. And then we treat them as expected moments that require reflection, compassion, and problem solving. And then this will help us to at least increase the chances of changing a new and helpful behavior into a habit. So if we understand how setbacks are part of the behavior change process, we are more likely to achieve important goals and facilitate meaningful change in others also. So this comes from the stages of change model, which is a simple framework as shown in the diagram here, which can be used to support people on the behavior change process, identify what stages of change they are in, and to better tailor interventions and resources to promote their enablement and action. So from these stages of change model, Megan proposed 3 questions that can provide a useful strategy for people to get back on track and to sustain behavior change while we're doing our behavior change interventions. The first question is, what did I learn from this setback? Second, what needs to happen for me to get back into action? And thirdly, being kind with yourself. How do you want to treat yourself while working towards change? So this is an example of using theory to influence behavior change. And if we look at the second question, which says what needs to happen to get back into action, may only be answered effectively while we are considering context. Intervention mapping. Intervention mapping, as described by Koch and others, is a practical guide for behavior change intervention. It has been developed in the field of health promotion since the 90s and has been applied mostly to that field. But right now it's being used by any intervention that involves changing behavior. It is guided by 3 perspectives: the multi-theory approach, the ecological approach, and the participation perspective. Correct application of this protocol is meant to produce behavior change interventions that fit into the local context and that have the best chances of effectiveness. Permit me to narrate just a few examples of successful behavior change programs in Nigeria. Before I go on, let me say that there have been a lot of concerted efforts to promote and sustain successes in behavior change intervention. We have had a lot in infant and young child feeding, but there are other unique examples that I would like to quickly highlight. The first one here is the fruit and vegetable behavior change intervention for persons with hearing impairment. Persons with hearing impairment. In that intervention, it was a 12-week school-based intervention, including BCC and unlike F&V fruit and vegetable product provision. And this was implemented, motivating, inspiring, and enabling the hearing impaired students. It was based on the health belief model, so there was theory, there was evidence that was made use, but there was also contextualizing, and there was and there was also enabling, because there was on-site fruit and vegetable provision in the school, working with vendors to make sure that these fruits and vegetables were accessible and affordable and acceptable. The program was a success. Because there was better fruit and vegetable consumption, which was sustained long after the behavior change intervention. This was conducted by colleagues here in the University of Ibadan, Nigeria. I'll also talk about another intervention. This has to do with industry-based FrieslandCampina in Nigeria, in collaboration with the Nutrition Society of Nigeria. They carried out a behavior change nutrition community strategy, communication strategy for children between the ages of 4 and 6 years. It was tagged Drink, Move, Be Strong Nigeria. And it was based also on the health belief model. It involved more than 600 teachers, 15,000 teachers, and more than 4,000 parents in several states of the nation. Here's a picture of some of the intervention materials that were used, the healthy meal cards. And at the end of the program, it was a success. It educated and motivated children to eat healthy, to drink day milk, and also to stay active through exercise. I believe the program is also being planned to be scaled up in the nearest future to many other states of the nation. There's another example, is also from industry, the Follow in My Grain Footsteps program in Nigeria. And in this intervention, the programmers explored the effectiveness of an intervention to change how people cook their dishes. The theory of planned behavior was used, and the success was that branded behavior change program increased the awareness of anemia, changed cooking behaviors, and helped women to increase the amount of green leafy vegetables added to stews to help to increase the intake of iron. Let's go to some final thoughts based on all that we have discussed. Motivating and inspiring and enabling people to adopt desired behaviors requires careful, thoughtful science that comes from a deep understanding of the nature of what motivates people and what are the social, cultural, and economic contexts that surround them. For healthy nutrition and lifestyle, we need to understand and consider this, as well as the food environment, so that we are better able to support change. Specifically, we need to remember that the appropriate use of theory, evidence, and proper contextualization is important, not forgetting the social environment and food systems. Also, we need to look at the future by identifying evolving social behaviors. We know that there's a nutrition transition that is happening globally, and with this nutrition transition is evolving behaviors that have to do with nutrition. So we have to identify these evolving social behaviors early and how these may be tapped for positive impact or countered where negative. We also need to be reshaping food systems, trying to innovate our food systems and creating enabling food environments in support of healthy diets. One other thing is that we need to take the behavior change interventions that have worked, we need to take them to scale so that more people benefit, and that we can actually positively shift nutrition and health all over the world. Also, we need to use a systems approach to behavior change, thereby employing multidisciplinary methods. And that is where the question comes. What collaborations with experts have we as nutritionists, as health workers, have we undertaken with other experts? What are the untapped collaboration potentials between the BCC experts and the health and nutrition professionals? And how has this pushed the borders or has impacted our work? What type of support or collaborations do the non-BCC, non-behavior change communication professionals require from the experts that are lacking? These are the final thoughts that I want to leave us with. When we innovate in behavior change interventions, we know that there is always a better way to do it. And like Thomas Edison said, we have to find that better way. So with this, I want to thank you for your kind attention, and the floor is now open for questions and answers. Over to you, Dr. Charles. Thank you very
much. Thank you very much. Thank you very much, Dr. Samuel, for that presentation. Right now, we are going to address some of the questions that have come in. I have one here from Anonymous. The question goes like this. Looking at the multiple factors affecting healthy lifestyle behavior, what should be the first step healthcare professionals should take along in their approach for effective changes? So I hope you got that.
Yes, I did. Thank you. Do you want to take more questions, or do you want me to answer them one after the other?
Well, okay, let me take another one. I will just take two so that you can respond to the two. We'll now move to another two. So the second one is from Min. Is asking, do you have any recommendation for books or courses to learn the practical way to apply the theory for behavior change? Sometimes we understand the theory, but we do not know how to apply the theory. Thank you for sharing. So I think asking more of resource materials. So you can take the two.
Okay, thank you very much. Let me start from the very first one. Thank you for that question. It is true that we have multiple factors that affect behavior change. And there is also that question that comes to mind, like you have asked it, what do I do first? I think the first thing is to understand the issues, understand what exactly the behavior is and what is shaping that behavior. By careful observation, by contemplative listening to our patients. Most of the time we rush ahead to diagnose a situation and just quickly prescribe, tell them what to do and what not to do. In my experience and from all that we have talked about for behavior change intervention, that might not really work. So when you take a history of the patient and you listen carefully for in between the line information that can help you to appropriately tailor your behavior change interventions or to appropriately apply the right theory to help such patients or such individuals to change certain behaviors. The second question talks about recommendations for books or courses, resource materials. Luckily, we are in the times of explosion of knowledge on the internet. There's a lot of resources online on behavior change interventions in different countries. So while I would not recommend a particular book or a particular website, I would encourage you to mine great possibilities from what we find online, not just individual books. You can visit university websites, you can visit industry websites, you can visit websites of development organizations, and many of them have done a lot in these areas. Thank you.
Okay, thank you for that. We have two more questions that you take. We have Anonymous is asking, how should food systems and framework be remodeled to adapt to the COVID-19 situation? So that's one. Then we have another one from Navisa. Can social media be used or have any impact on behavior change? Is there any proof or is there any study? So,
okay, thank you very much. Let me start with the e-health question. Can social media be used? There's a lot of information and evidence to show that social media helps. There are text message or SMS-based interventions whereby customized messages are sent to people to help them improve their knowledge about a certain healthy nutrition situation, but not just that, motivating statements that can help them, follow-up situations that help them. Right now, I belong to a WhatsApp group where we have a 21-day challenge before Christmas to move more. You mean, this is also innovative. It's part of social media. And we kind of hold ourselves accountable, because at the end of the day, you have to post the number of steps that you took for that day. And when you find out that over the last 5 days you've been behind, you're motivated to move more. And then when you see people that have the same challenge that you have, talk about how their challenges were approached, then you can also learn from that. So what I'm saying is that social media can help. There are video games, there's gamification, so many aspects of the social media can help to change our behavior. We're talking about food systems and frameworks that we can remodel to adapt to the situation of the COVID-19. Now, that's a very big question. Thank you for that question. When we see you remember from the framework of the food systems, we have so many drivers, so many entry points, so many food supply, the food environment, so many things are involved. Model each one for the COVID-19 situation is a huge task, but I trust that it is something that we can do step by step, and it depends on what is happening in your own context. For example, I would say that we found out in Nigeria, because we had a very small study during the lockdown, a WhatsApp-based study to see how people were accessing food and what were they eating. We found that there was a great awareness around vitamin C and consumption of fruits and vegetables. How does the food system respond to that? First, we make fruits and vegetables more available, more accessible. How do you work with vendors to make it more attractive and more desirable? Riding on the crest of the wave of the increased awareness for vitamin C in COVID-19. That is just an example, but there are several many others. You can nudge people. I also saw that during the COVID-19 situation, for many people, there was an increase in physical activity. Although for some, there was a decrease because they could not go out. But for those who had safer neighborhoods and with less dense population, there was an increase in physical activity. And immediately the lockdown was released, that also went down. The food systems, the food environment must be sensitive to such changes and make decisions, policy decisions, make reference, allusions to all these things when we are counseling people or when we are trying to change their behavior. So like I said, it's a very big topic, but I think I've stimulated some thoughts in that line. Thank you.
All right, thank you very much. We have a question here, still from an anonymous. It's asking, looking at the examples you presented on the behavior change interventions, these are more group programs. What is more effective in your opinion? Is it individual or group interventions or programs to change behavior? That's one. Then the other question is asking, is there any evidence about maintaining motivation for behavior change? So you can take the two questions.
Thank you very much. There's a lot of evidence for maintaining motivation. There are studies that have shown that, for example, the study of Megan Cole that I alluded to talks about how do you maintain good behavior by understanding the issues of setbacks, by making an individual who wants to change behavior understand that having a setback is part of the whole thing. You will experience a setback. And when you experience it, what actions do you have to take? What do you learn from it? Are you going to be kind with yourself, forgive yourself and move on, or are you going to let it get you down? So there is a lot of evidence, there's a lot of studies in psychology, in sociology that have talked about how to maintain motivation, especially how do you treat setbacks so that you can overcome those setbacks and maintain good behavior. There are many studies in that aspect. Most studies that I've seen have come from America, from Europe. I've not seen many of those kind of studies in Africa. So there is a gap in that. The other question talks about what is the best approach? Is it group approach? Is it individual approach? Is it programs? You will notice that in the presentation, I said I was going to present examples of programs. I said programs because behavior change intervention is a long-term thing. So when you have programs that don't take more than a year or 2 years or 3 years, I still classify them under programs that need to be scaled up longitudinally, okay? But what we see is that there's always the benefit of a group approach. There is an African proverb that says, I don't know whether it's African, there is a proverb that says, if you want to go fast, you go alone. But if you want to go far, you go with many other people. I think that is the thinking behind group approach. It's always good to have more than 2 or 3 people involved in an intervention. It helps to sustain behavior change better. It helps people, they learn from each other, they support one another, and then they can also influence a wider group within the society, starting from the family and then to friends in the workplace and all those places where they have networks. Thank you.
All right. Yeah, some of the questions have been taken care of by some of the comments you've made, but I have these 2 questions that I would like you to address. Nuru is asking, what about using WhatsApp group or using mobile phone or mobile apps as medium of empowering community to change their dietary behavior? Now, one that is related to that, I would like you to still answer is ST is asking, what happens if we try numerous times to motivate the patient but without success? Do you suggest that we convert back to the conventional method of counseling, or we keep trying? So take the 2 so that we can.
Okay, thank you very much, Nuru, for the question on mobile apps. I think I mentioned something about that we can use WhatsApp groups to empower people for change in the society. WhatsApp groups have a lot of potential. And in recent studies here in Ibadan, in Nigeria, we also found another dimension to that among low-income consumers, that Facebook has a higher impact amongst them than even the mobile apps, because than the WhatsApp, because the WhatsApp requires Android phones, which they cannot afford, while the Facebook can be done on their small phones that are not Android. So what I'm trying to say is that all this, any medium that brings people together with a common goal or with common characteristics can actually help. So WhatsApp groups can really help. The question of ST was on motivation, and if you motivate somebody to change behavior and it doesn't happen, what do you do? You remember we talked about motivation, inspiration, and enabling. Now, no matter how motivated I am, if the situations around me does not support or enable me to change, it remains a mere dream. And that is why we are saying behavior change has to transcend motivating or inspiring. You can do it, to actually enabling. And part of the enabling, I talked about nudge. I'll talk about nudge again. When I visited a certain place in the Netherlands, to be specific, FrieslandCampina office, one of those days, I saw that on the staircase there was written the number of calories you burn as you go higher. I was tired that afternoon. I wanted to take the steps, but it nudged me to climb those steps because it gave me a good feeling at the top of the stairs and I've burnt 200 kilocalories. Fantastic. So that is a kind of enabling. So when we talk about enablement, it's not just providing things or handing out freebies to people, but actually nudging them, enabling them, empowering them to change. So you move from motivation to inspiration to enabling people to change their behavior. So the original or the traditional approach of counseling, like I said, has some element of talking down on or instructing, giving do's and don'ts, giving 10 commandments. I mean, the world has gone past that now to actually understanding what this person feels, understanding what the challenges or the barriers or the enablements of behavior are, and bringing them to the fore for this particular individual to change behavior. Thank you.
Thank you for those comments you've made. I will ask. I think you have actually answered the question by Francis on the role of nudging techniques in behavioral changes. You've actually addressed that. We have a question from Ingroboj Bovi. What can be done to raise a new generation that is brought up with healthy eating or lifestyle behavior and doesn't know any better? What are crucial elements for that? And he still asked, or he or she still asked a question on making the healthy choice the most easy choice can contribute to behavior change. What can be done, example in Nigeria or African context, to accomplish this? So the same person asking two questions in that regard. So answer the two questions.
Thank you, Inge. I think her name is Inge. The new generation, how do we bring them up with healthy eating? I would like to approach it from two ways. First of all, who are the mothers of tomorrow? It is the adolescent girls of today. So I think we can leverage on that by catching those ones young. If we can catch adolescent girls by inspiring them, by motivating them, by letting them understand what it means to have healthy eating and incorporating it in such a way to make them know that they have a role to play in that. They are right at the center of it, looking at the first 1,000 days of life and afterwards. I think we can harness, I'll use that word, harness some advantages from that. The other way will be the school setting. Every young child goes to school. So the school setting is a very important aspect. And in the school setting, we'll not forget the teachers, because we know that these youngsters believe their teachers even sometimes more than their parents. So we use the school setting as a powerful force for health promotion and to bring up a new generation that understands healthy eating, and not just understands healthy eating, feels that healthy eating is cool in bracket. They have to understand that it is something that is socially acceptable, something that makes them feel good. That's where the motivation and inspiration comes in. The other question from Inga talks about how do we make healthy choice the most easy choice, especially in Nigeria. In Nigeria, first of all, the healthy choice, is it available? If it is available, is it accessible? And when I talk about accessibility, I'm talking about the food environment, the retail outlets, the retail points, and not just physical accessibility, social accessibility. Are they in a place where the low income feel free to purchase it, to go in there and buy? These are questions. Are they acceptable? Do they stem from socioculturally acceptable behaviors or current practices? These are ways that we can make healthy choices the more easier choices in Nigeria. Affordability is also a big issue, and over the years we have seen that, for example, I'll talk about maybe sachets of milk. Over the years, the concept of minimizing and making them into small sachets that are affordable for the low income has also brought this healthy choice closer to them and easier for them. So these are some of the thoughts that I have around that question. Thank you very much.
Oh, thank you. I think I will just have to take 2 more questions and round up the webinar. Anonymous is asking, how do we ensure impactful and sustainable behavior changes after BCIs? Most interventions are 12-week or months duration. How do we ensure individuals sustain behavior change after the intervention? I think this is a very important aspect of a behavior change, sustainability. And I will still want to, okay, I think we've captured most of the questions. And then is a comment from Zato. Good to see collaborative efforts between medical society and industry able to benefit society. Well done. So I think it's practically one question from Anonymous.
Thank you. Thank you, Anonymous. How do we sustain behavior change interventions? It starts from the beginning. How did you start that behavior change intervention? Did you build in ownership at the beginning with the participants? Do they see it as an outside intervention that was brought to them? Or was it co-created? The issue of co-creation helps to breed ownership feelings, such that at the end of the program, they think, oh, it is our program, it must not die, it must continue. So that is very important. But there's also the issue of stakeholder involvement. Do we identify all the stakeholders that are around that intervention? Do we carry them along sufficiently? Or do we leave it just to chance, such that at the end of the day, any one of them can come in and scuttle what you have worked so painfully hard to do in 12 weeks? So stakeholder identification and involvement is very, very important. And I'll also say that social acceptability is very important. While the intervention is on, there's a way that participants can carry on with you. They have enough incentive, enough motivation. But as soon as you leave the scene, they are open up to back to their own society. And if their society does not accept it, they quickly, draw back from that intervention, because everybody wants to be acceptable where they are in their own society. So I'll look at those 3 things for sustainability. There are many other things, but majorly I'm talking about ownership, stakeholder involvement, and social acceptability. Thank you.
Thank you, Dr. Samuel. And I think your last comment says it all. When people go out and see others using their face mask, they are encouraged to use that. And when they go out and see that they are the only ones using the face mask, they are discouraged from using the face mask. So I think this is a very fine place to draw the conclusion for today's webinar. So I think you've received some messages about evaluation form that will be sent to your emails. Please do well to send your reply or fill the evaluation forms so that you can receive your attendance certificate after the webinar. Thank you all for participating in this webinar. I hope that you have had a fulfilling evening or morning or afternoon, depending on where you are. I have actually had a fulfilling evening in my area. So please, I will encourage everyone, put on your best, put the little you can for behavior change, and change your own behavior first. Thank you very much. Stay safe and stay healthy. Thank you, Dr. Samuel.
Thank you.
For this insightful presentation. And thank you, FrieslandCampina Institute. We hope to get more of this as time goes on. Thank you and stay safe.